Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Edward Rogoff. He's a professor of entrepreneurship, patient advocate, and author of the book, Scary Diagnosis: Navigating Fear, Finding Strength, and Securing the Healthcare You Deserve. There's an excerpt from that book on Kevin MD. Edward, welcome to the show.
Thank you very much. Pleasure to be here.
All right. So let's start by briefly sharing your story and then
Yeah,
jumping into the excerpt that you shared with us on Kevin MD.
sure. So I was born with hemophilia, and as a child, the treatments for hemophilia were very limited. As I became older, after I was around 20, the treatments drastically improved. Today, they're quite good. But I was hospitalized a number of times as a child. I dealt with a lot of issues with school and family and et cetera, dealing with it. I became active in the Hemophilia Association, and I was the president of the Hemophilia Association for many years. I'm still on the board. I was on the board of Live On New York, which is the organ donor network in New York. And my connection to that is that 15, 14 years ago, I received a liver transplant because I had contracted hepatitis C from a blood transfusion as a child. And over the years, it diseased my liver and had cirrhosis. I had liver cancer. And I, wonderfully got a liver transplant, which cured all that, including my hemophilia.
Hmm.
So anyway, so I've been active with patient groups. I've been connected to many patients personally, for many years. And that prompted me to write this book is I felt there were many issues that patients needed to learn about. And there was a lot of wisdom that I could garner from people I had met on various issues of being a patient and dealing with the healthcare system.
So let's talk about one of those issues that you excerpted on Kevin MD is
Yeah.
how to choose the right doctor for you. So this particular excerpt, tell me what it's about.
Yeah, so I think to start with, I think a lot of patients don't feel they have any agency or any power in selecting their doctor. They feel it's like, well, this is who, you know, my doctor gave me to treat my particular ailment, who my GP gave me to treat my particular ailment, or this is who my insurance company, came up on the website. So they feel they have no agency in that. And that's by and large not the case. So they should be willing to be active in this and make an informed decision about who they want for their doctor. And I think there are a lot of issues. One is the doctor really treat exactly what you have? Is this a doctor who specializes in caring for patients who have your ailment, number one. Number two, does the doctor pass a chemistry test with you? Does you feel comfortable with this person? Do you feel comfortable sharing information with them and being completely open with them? I recommend that patients look at the history of the doctor, not just the medical school, but also where they did their training. Did they do their training at a really patient-focused institution where the doctor would have received knowledge and experience in a culture that's really patient-focused? So I think there's a lot of issues that a patient can be active about and end up with the right doctor. We've all known people who say wonderful things about their doctors. I'm so lucky I have so and so, and this person's been so generous with me with their time. And then there are others who go like, I dread going to see this doctor because I know he or she is going to push me out in 6 or 8 minutes and not listen to what I'm saying.
So isn't that some of that context dependent? So seeing a specialist versus a primary care doctor, or whether you have an uncommon or rare condition versus going for a routine checkup. So finding a doctor, for instance, that may only treat a rare condition may be more difficult than saying someone for a routine checkup, right?
Right. And I think, look, very few people end up with just one doctor, right? People end up being treated by a team, and that team includes the doctor and the nurses and the assistants in the office. There's a team there. And, so you need a GP. but you also may need a pulmonologist. You may need a neurologist. And you need to accept that and work towards building that team that you feel is really giving you what you need.
So going a little bit more granular, let's say a patient gets the
Yeah.
name of a particular physician, like you said, from the insurance website or
Right.
their primary care doctor referred that patient to a specific specialist. And you said that patients should do research on that doctor. Tell us where they can start doing that.
So, they can start with Google. I mean, it's really simple. There's so much information available quickly and easily and publicly. A lot of doctors, most doctors, publish their bios anyway. But if they're associated with a hospital, they probably have a bio there. That gets them, started. I really am a big believer that the new AI tools that are coming out are easy to use and they provide a lot of information and they're interactive. So, Google's, wonderful resource without a doubt, but using an AI tool, you now probe with the system. Can you tell me anything more about this doctor? Has the doctor's patients published anything about them, written anything about them? Does the doctor have any lawsuits? What happened with those
Mm.
lawsuits? So, you can probe and find out about this doctor. Are there any videos available about the doctor? Almost all doctors now have some video content somewhere, and that gives the patient a little bit of knowledge and a little bit of feel for what kind of person this is.
Now, one of the things that you said is to research where they went to medical school and
Right,
whether their residency was patient focused.
right.
So, how are patients supposed to know which residency is more patient focused versus others?
Yeah, I think, then you need to look at those institutions where they, look if a doctor trained at the Mayo Clinic, it's a pretty good guess that that person is going to have been trained in a patient-focused setting. I had my liver transplant at the Cleveland Clinic. It's a wonderful institution, and I would feel comfortable about any doctor who was trained in their system who's gone on to work someplace else. But if it's not a well-known institution with a high profile, again, you got to do a little bit of research. And also you can ask people at the institution you're at, ask the nurses, ask the assistants, can you tell me, is this doctor, friendly and patient with their patients? Does this, do you think I'll be happy with this doctor? You know, I think it's worth doing that work ahead of time. And I think this, the subsequent part to that is whether you've done the work or not, after the first meeting or two with the doctor, if you're not comfortable, you should work on changing, find another doctor. I, have a friend who has some heart issues, and her husband goes with her to the doctor's appointments. And the cardiologist that they saw said to the husband, I want you to sit over there behind me, and wouldn't answer the husband's questions.
Mm.
I, this is enough warning signs that you should be somewhere else. That's not the way you want to be treated.
Now, that goes to what you said earlier about the chemistry test, right? That
Yeah.
you have with the doctor after meeting them for the first time. Now, do you think that this is more of a gut feeling? Do you have a systemic approach to see whether you have proverbial chemistry with that doctor?
Yeah, well, I think one thing is, and I feel sorry for doctors who are in these systems that so drastically limit and monitor how much time they spend with each patient. That's really probably not what they got into this profession to do. But nonetheless, if you're the recipient of that and you feel that the doctor is watching the clock more than they're watching you, that person is going to fail the chemistry test.
One of the things I wanted to get back to when Googling doctors online are the issue of patient ratings, right? So, of course, Google itself has like 5-star ratings for doctors. How much
Right.
stock should patients take into other patient reviews of a particular physician when they're researching them?
Very little, very little. That's not a good system, right? I mean, People can be unhappy with doctors for a lot of reasons, having nothing to do with the doctor, having to do with the institution, having to do with their personal situation, having to do with their health condition. There's all kinds of reasons. And then there are doctors who manage the ratings, to get people to write positive ratings. I've had doctors who have asked me to go and to post a rating on their site. I mean, I guess it's good that they're managing it, but they're obviously only going to ask a select group of patients who they think are going to post very positive messages. So I wouldn't put too much stock in those.
What about the physician shortage, right? Because not all
Yeah.
patients have the luxury of choosing another physician if they don't pass that chemistry test with the first one,
Or-
right? So, how about in those situations where sometimes it takes 6 to 12 months to see a particular specialist, right? So,
Yeah.
what do patients do in that context?
Yeah, well, this is really, this really speaks to some of the big shortcomings in the healthcare system, in the US. Yeah, it's terrible. Obviously, in a sense, you need to accept what you can get. And, you may not be thrilled with it, but that may be the best you can do. But you shouldn't give up on looking for somebody who you're really happy with. And, yeah, it's really a problem. And I think the other thing is, Kevin, is that a lot of care is given by people other than the doctor,
Mhm.
right? The patient, the doctor's assistant, the nurse practitioner. Many patients end up dealing, over the long run, they end up dealing with them more than they deal with the doctor.
Now let's zoom out a bit. This excerpt, of course, was from your book, Scary
Yeah.
Diagnosis: Navigating Fear, Finding Strength, and Securing the Healthcare You Deserve. So, outside of choosing the right doctor for you, tell us some of the other key messages you want readers to come away with after reading your book.
Yeah, so I want them to realize that they can't do this alone. They need to build a team. And I talk about in the book, what team members you want. Who do you want on the team and who don't you want on the team? So I think that's a very important part of this. I think that I'm trying to in the book inform patients of the broad issues that they're going to confront in the healthcare system, to understand how insurance companies work, to understand how hospitals work, to, understand what they're going to go through emotionally as they deal with that scary diagnosis and how to cope with it. And I think ultimately the book is not negative. The book is positive. Certainly there are diagnoses that lead to negative outcomes. But by and large, you're going to have a serious issue. You're going to be fine and you're going to deal with it. You're going to get care. The medical system is better in many ways is better than it's ever been. And so you need to maintain some optimism about getting through this and that you're going to come out the other side. And along the way, you need to maintain your life. You need to stay close to your family. You need to stay connected at work as much as possible. So the book has a broad range of issues that it covers, from the emotional issues that affect the patient and the caregivers to the nuts and bolts of being a patient and dealing with the broader healthcare system.
So let's quickly address the first thing you said in terms of who patients want on their team and who
Yeah.
don't they want on their team. So just answer that question. Who do
Yeah,
they?
so they want people who are going to do things that they have trouble doing. So maybe you need somebody to pay bills for you.
Mhm.
Maybe you need somebody to go to appointments with you. Maybe you need somebody who's just going to come over and watch baseball games with you so that you can maintain as much as possible, a happy existence, while you're going through your treatment. Who you don't want on the team are people who think they know more than the doctors. You don't want people who are, self-proclaimed experts and are going to start telling you what to do. Ultimately, this is the patient's decision as to how to proceed with their care. So people who express their opinions is one thing. People who sort of bully the patient into do this or do that, you don't want that. You don't want people who are negative. There are many people who just as a matter of their personality. And when they encounter the healthcare system, they become very negative. You don't want that. So, you want the right mix of people, and it makes a huge difference. And I say this over and over and over. You can't do it alone. I've been through a lot of health issues, and I never could have done any of them alone.
We're talking to Edward Rogoff. He's a professor of entrepreneurship, patient advocate, and author of the book Scary Diagnosis: Navigating Fear, Finding Strength, and Securing the Healthcare You Deserve. That excerpt from Kevin MD is How to Choose the Right Doctor for You. Edward, let's end with some take home messages they want to leave with the Kevin MD audience.
The take-home message is this is a big, complicated system, many issues to deal with. And as you encounter it, you need to work on learning and familiarizing yourself with various aspects of the system. And the more you know, the more comfortable you'll be, the better care you'll receive, the better the outcome will be.
Edward, thank you again for sharing your perspective and insight. Thanks again for coming on the show.
Kevin, a pleasure. Thank you so much.